Can we talk a little bit about hormones? Because I think I have a very sort of old school understanding of like vaginal dryness, vaginal estrogen, hot flashes, systemic estrogen. Otherwise, I got nothing. I can stay away from those hormone salesmen, snake oil salesmen who are just trying to get rich off normal things. So am I close? Am I way off in my management? Like help me out here, because I sort of feel like I'm doing what I was taught years ago, but has much evolved? Tell me how you approach those types of questions, those types of patients.
Yeah, you're actually not that far off. So I do give yourself a little pat on the back. The same thing. So many people come in, I want to check my hormones. And so at the same time, I don't just say, okay, let's check your hormones. I say, okay, well, what is it that's bothering you? Why do you want to check your hormones? And let's talk about whether this is going to be useful or not. And most of the time I'm telling them, I don't think this is going to be very useful, but we can check. Now, sometimes it is, right? If they're having irregular periods and symptoms, we want to look for things like PCOS. We want to rule out, thyroid disease. We want to look for, prolactin issues. So all of these other things. But honestly, I'll check an FSH because if it's elevated, it kind of confirms what I tell patients we already know, that you're at least in perimenopause. The level is not going to tell me when you're postmenopausal. So if you don't have a uterus, that's a little trickier to do. But, we have to go by the periods at least somewhat. But we'll check an FSH and we'll look at things like estradiol and progesterone and testosterone. I don't even require a baseline for that. I do it if somebody wants to know it, but I'm not going to treat somebody based on those numbers. I would use those numbers more, when we're treating somebody, if we want to adjust the dosing or if we want to sort of look and see if things are getting, a little too high around those areas, then I would look at those hormones. But most of the time, the labs are fairly useless to me, other than ruling out the other conditions that can kind of mimic perimenopause and menopause, particularly the thyroid disease. And the way that I always counsel my patients is I tell them, look, we're not going to treat a number. And while there are, especially here in South Florida, so many of these bioidentical hormone clinics that say, we're going to test your saliva or your blood or your urine, and we're going to look at these levels of hormones, and we're going to give you this number of hormones based on, what it is. And I have so many patients that come to me and they say, well, I'm on this because my level was low. And I was like, okay, but what were you feeling to get on this? I don't want to treat a number. I don't want to treat a lab. What number you have today is going to be different than the number you have tomorrow versus next week, because they're still fluctuating. And what number feels good to me is going to be different than what number feels good to my patient and to their sister and to their neighbor. So we really want to treat based on symptoms, not based on those lab numbers.